Welcome to The Other Side of Medicine, a trusted source for education, not medication, for 35 years. In every episode of The Other Side of Medicine, we deliver health information your doctor won't tell you about. My guests are the nation's leading health experts in science-based natural medicine, physicians, authors, researchers, and clinicians. We believe natural medicine should be first, drugs and surgery last, and so we promise to deliver you the next generation of health information built on three principles: common sense, science, and cooperation with nature. I'm Dr. Krystosik, and we are glad that you're spending some time with us. This episode that we're talking tonight with a special guest, Karese Laguerre. Now, before we jump into tonight's episode, folks, I really want to welcome you first-time listeners, and then I don't want to forget about those of our community who come here every single week and support us. And I want to just thank you for your comments, for your likes. If you could just give us a quick, like or a shout out that you have a comment or a question, one of our experts will get back to you with information that will help you to be able to achieve optimal health. Our goal here is to help you become independently healthy. So if you can get information like this, it would be worth thousands and thousands of dollars if you would try to go out there and pay for it. But we have it free for you. We want to give you health care that is going to be able to make a difference in your life. So just like I said, we'll get back to you as soon as we can. But if you're one of the health nuts that comes here every single week, once again, I want to really, applaud you for taking charge of your health, because that is the most important thing, to take a proactive role in your health if you want to become independently healthy. So I'm glad you're on this journey with me. And with my guest tonight, it is Karese Laguerre. She is, by her profession, a dental hygienist, but she then delved into a whole different realm of education and background called myofunctional therapy. Now, when I first heard it, I scratched myself. I had to think a little bit. I know what myo is, but in the context that she uses this particular therapy, it's quite interesting, quite intriguing, and has a lot of benefits. So without further ado, I'd like to really welcome our guest, Karese. Welcome to The Other Side of Medicine.
Thank you. Thank you for having me.
Good. Well, tell us, for myself and our listening audience, help us to understand what myofunctional therapy is.
So myofunctional therapy, in the simplest way possible, is kind of like having a personal trainer, but for all the muscles below the eyes, but above the shoulders. So I work with the orofacial and some of the oropharyngeal muscles to help strengthen and coordinate them. We eliminate compensatory patterns and recruitment of muscles or improper use of muscles in that region. And that's really going to help to leverage for those who might be struggling with orofacial pain, temporomandibular joint disorders, or if you're having any sort of discomfort when you're breathing or digesting.
Mm-hmm. Mm-hmm. So your particular area of myofunctional therapy happens to be from the neck up, correct? Would that be a fair assessment?
So, yes.
Okay. And as a dental hygienist, how did you drift into this particular area of studies, and you're now have made it pretty much a big part of your profession?
It's all I do. So I don't practice clinically anymore with dentistry. I am exclusively with myofunctional therapy. And that all really happened because of my children. It was a pediatric dentist, actually, that I was working for that had enlightened me to what some issues were that my children were experiencing and how it was so related to the way that they were using their oral facial muscles, and how one simple shift just in the way they were breathing, just in the way that they were using their muscles, was going to make such a huge difference. And if I can kind of share the story like a little bit deeper, I'll tell you exactly what they were going through. Is that okay? Do we have time for that?
Absolutely. Please do.
Okay, so I have four children, one boy. He's the oldest, and he's been disappointed every time I've gotten pregnant since. But my son, I remember we were in kindergarten and we were talking to the kindergarten teacher, and she would tell us that, he had no amount of focus. He was difficult. She had to redirect him a lot. They want to sit down for circle time, and the only time you would see him focusing is if there was a ray of sunlight coming through the window. He would find one of those little dust bunnies that are floating in it, and his eyes would follow it all the way down. But outside of that, nothing. No started to focus. So I, at that point, was like, okay, but he's 5. That's okay. It's kindergarten. It's not a big deal. He's a 5-year-old boy, totally normal. It's okay. Then, as he gets into first grade, we have the same conversation, and second grade, and third grade, and fourth grade, and we kind of dismissed it along the way. As he's 6, he's 7, he's 8. Okay, we might need to start paying attention to this. And in fifth grade is when he was officially diagnosed with ADHD. And I'll come back to his story in just a second. But my oldest daughter had every sleep issue under the sun. I mean, you name it, and we had sleep issues every single night. So whether it was night terrors, bedwetting, sleepwalking, which is incredibly scary as a parent to hear sounds and not know how your children made it down a flight of stairs. Like, it's very scary, sleepwalking. But we had all the sleep issues, you name it, tossing and turning, falling out of the bed. We had it. My youngest 2 daughters had a lot of upper respiratory issues. So it was chronic ear infection, throat infection, ear infection, throat infection, ear infection with a throat infection. I mean, they were always congested. There was always something going on upper respiratory wise. And although all of these children who are genetically very similar and grew up in the same household, experiencing the same nutrition and diet and so forth, they manifested very differently. But it all really related to how they were breathing, as the pediatric dentist had really pointed out to me. Specifically so for my son, and he's the story I like to talk about the most that really got me to dive in to myofunctional therapy, in that we spent a year and a half with medications, alternating through 3 different types, trying to find which one would work best for him for his diagnosed ADHD. And none of them really worked out that well. And once I was enlightened about myofunctional therapy and how breathing really does impact sleep, I came across the fact in my research that there's a 70% overlap between the manifestations in the symptoms for ADHD, which is a symptom-based diagnosis, and that of sleep deprivation in children. So children who are struggling to get a good night's sleep repeatedly, and so they're sleep deprived now chronically, 70% of an overlap in those symptoms. And so it was very eye-opening for me to realize that there was a differential diagnosis that was potentially missed at that point. And when I brought that up with his pediatric neurologist, who was one of the top people in the States, we waited a long time to get to see her. She essentially confirmed that for me, that there is that relationship between sleep and ADHD, and it is a differential diagnosis that we needed to explore. And it turned out for him that that's what it was. And so through myofunctional therapy, through me really diving in and working with him very closely, we were able to get to the point where he no longer was on the medications. We refused to do medications anymore at that point. We were able to just do the myofunctional therapy, help him improve his sleep, and he wound up being a early graduate. He graduated high school at the age of 17, a year before his friends, and it was the biggest game changer that really led me down to know I need to do this for as many people as possible. Like, this needs to be out here.
Now, that's really interesting that it was able to help your son with ADHD. But I'm curious to know, you had mentioned your daughters having the upper respiratory problems and all the repeated infections. Talk about that. And did you see a change with those particular symptomatology and those episodes of those upper respiratory problems?
Absolutely. So we actually got to a point with the upper respiratory and the antibiotic like cycle that we were in, where my husband at some point had asked the pediatrician to just prescribe a keg of amoxicillin. Like, why do we keep coming back for the same prescription for the same thing? And once we finally got into this myofunctional therapy thing, what happened is that we eliminated with myofunctional therapy, one of our big things is proper oral resting posture, and we're really prioritizing and trying to get to the functional use of the nose. What the nose is for breathing. And so we eliminated the mouth breathing that was going on. One of my daughters had enlarged tonsils and enlarged adenoids. Between collaborative care, because collaboration is very important, we were able to do expansion with a dental provider. But then on top of that, the myofunctional therapy to really restore the functional ability to utilize the nose and utilize the muscles appropriately around the upper respiratory tract. Once we started that system, I have not had, and I will knock on all sorts of wood, but we have not had antibiotics in our home for maybe the last 7 or 8 years. It's been a long time since we've had an upper respiratory infection.
That's very impressive. I've never really talked to anybody who's had that kind of success rate with people having upper respiratory problems. With people, you're saying that it's the mouth breathing that triggers the upper respiratory infections. Is that what you're saying?
Yes. So it's a very compound thing, right? I'm sure for most people, it's multifactorial. In my children's specific instance, the mouth breathing, aggravating the enlargement of the tonsils and how frequently we get those tonsils infected, that was a big contributor in the sore throats. For the ears, our tongue is actually really responsible for helping us to clear out those eustachian tubes. And when our tongue is adequately swallowing, so when we have that mature swallow pattern, it's going to actually press against the palate, the roof of the mouth, and help to release a little bit of pressure off the eustachian tubes, and that helps them to drain. So once they were adequately using their tongue appropriately and now closing their mouth, so they're breathing through their nose and we're not having to have things filter or bypass through the tonsils, we didn't have those same issues. We weren't getting all that buildup in the ears to have those ear infections. We weren't getting the collection of anything in our tonsils, which was now going to be eventually winding up in that cycle that never ended with the sore throats. So it really did make a difference in our lives in such a positive way.
Now, have you seen the same results in the patients that you're treating with myofunctional therapy?
So I will say there's a spectrum. Everybody's a little bit different, but most people do see, even if it's not elimination of everything, they do see relief. So you get some alleviation from a lot of that. So where you may have been struggling a lot, you may come to a point where, okay, you've got one sore throat a year or one ear infection, or, potentially it starts to wind itself down to none.
Mm-hmm.
But absolutely,
still pretty impressive to get that kind of results, because typically what I have found over the years, and I've treated literally thousands of children with ear infections and throat infections and the upper respiratory infections in the lungs, by eliminating food sensitivities of a specific type. Is called delayed food sensitivities, or IgG reactions, not the typical reaction that a allergist will try to identify. Allergists are looking for IgE, which are immediate response. So I've found that delayed response are the typical problems that the people, and the children especially, as well as adults, who have repeated upper respiratory infections or any kind of repeated infections throughout the body. So it's typically these delayed food sensitivities, these food allergies that create that. But it's interesting that I could now refer people over to you and have you apply the myofunctional therapy and get an additional benefit and help to perhaps make some difference in other areas of their lives as well. So I'm really excited about how we met and how what we do can complement each other. And I really think that people need to learn about these things that are non-invasive, that are safe, effective. And again, there's research behind this stuff, right?
Absolutely, absolutely. Myofunctional therapy might be new to a lot of people as far as them hearing about it, but it's actually been around for over 100 years. It got its start in 1908. And so it is something that people have been researching and really experimenting for a long time. There have been a lot of good studies, and more recently, there have been all the systematic reviews, which are like the big case. We're going to assemble all of the data. And so, yes, it is very well researched, and it's something that I love to talk about.
Well, that's good because here on the other side of medicine, our whole approach to things is evidence based. We want things that are backed up by science. Grandma's remedies may have helped people, it may not. It may have just been something that the placebo effect worked. But we know that when natural therapies have science behind them, that's what we like to really delve into here on the other side of medicine. So could you share maybe one or two stories with researchers that have proven that myofunctional therapy has benefits in clinical trials or in other types of research studies?
Yeah, so there's a systematic review that was published a little over like a year and a half ago. Well, it might have been late 2022, and that was in the Journal of Craniomandibular and Sleep Practice. That one was a really good one that did a good 17 articles that it went through. So it's a great systematic review. And of those 17 that they really reviewed, it had phenomenal, wonderful effects on temporomandibular joint disorders, which we know a lot of people struggle with, and to the point where, people are getting Botox in their jaw, people are wearing appliances that they have to wear for the duration of their life, where oral myofunctional therapy really comes in, and it winds up being something that we can utilize to help leverage for temporal mandibular
Yeah,
joint
for our
disorders and
listening audience
orofacial
benefit.
pain. And so that study.
Yeah, for our listening audience benefit,
Go
that's
ahead.
TMJ. They know it typically by TMJ. So a lot of people understand that terminology, and that's something that this particular systematic study, which reviewed over 17 different research studies, showed that the myofunctional therapy was able to be effective for people with TMJ.
Yes, I'm sorry. I think I lost you for a second. I might have frozen. I missed just
Oh,
the
that's
last bit
okay.
of what you said. I apologize.
Was it on your end with your computer, or was it mine?
It might have been on my end. I don't know. It froze and then it was quiet.
Gotcha. Okay. Anyway, so I was just saying that the myofunctional therapy on TMJ was proven with this systematic study of over 17 peer-reviewed research studies that gave a summarization of the benefits. What kind of percent of benefits did they see with myofunctional therapy with TMJ?
Yes. So significant reduction of pain intensity by at least 34% when compared to other more or less conservative treatments. And it's comparative to no treatment at a higher percentage.
Okay, gotcha. Okay. All right. So, are there any other types of conditions that have been proven in research studies to benefit from myofunctional therapy?
Absolutely. So then there's obstructive sleep apnea. So obstructive sleep apnea, more often than not, the gold standard of treatment and care is always the CPAP, the continuous positive airway pressure machine. But CPAPs we know have a very low compliance rate. A lot of people just don't want to use the machine every single night. They find it cumbersome. But myofunctional therapy is actually shown to be very complementary to a CPAP in that it helps people to adhere to it better when you're working on the musculature. There was a wonderful study that was done in 2021, and that study in 2021 really got the AHI numbers. So the apnea hypopnea index, so AHI, those are the numbers that are really used when you get a sleep study. study done to determine how many apneic events. So apnea is when you stop breathing for 10 seconds or more. So how many of those events are happening? And the AHI numbers were shown to decrease from having 34 events to having nearly none at all, where we're looking at 9, less than 10. So that was a significant drop off, which is fantastic, because if you're thinking about how many times we're stopping to breathe at night, you really don't want any. So being able to decrease it by just doing oral myofunctional exercises is fantastic.
Yeah, that's really significant. Okay, well, let's shift, if we might, here just for a couple of minutes and talk about another condition that I was intrigued that myofunctional therapy is able to help, and that's tongue tie. Could you talk about what tongue tie is and how it affects babies and pregnant mothers and expectant mothers? What have you found with tongue tie in relation to the myofunctional therapy?
Yeah, so tongue ties are a very big topic nowadays. A lot of people are talking about it with relation to infants. A lot of times, nobody realizes that that tongue is actually the primary driver when it comes to getting milk from breast tissue. So biggest part of the latch is really that tongue and how it functions, at least for maternal pain, also for their supply, in order to really stimulate the supply and so forth. That tongue has to really compress against that tissue, and it's got to get enough of the nipple into the baby's oral cavity. That way they can really get the milk from there. So when we're having difficulty latching, one of the first places that we need to check, I know there's a lot of people who want to first start on the holds or work on the lips and the latch, but that tongue is incredibly important. So one of the first places where we want to look is under the tongue and to see what's going on. Is there restriction? Because there's a thin connective band of tissue that is primarily built up of fascia, and that band of tissue connects the floor of the mouth with the base of the tongue. And so if that tissue is tight or too anteriorly or forward in attachment on the tongue, it can inhibit the baby from having good mobility of that tongue to get the tongue forward and really compress against the breast tissue. So when we're dealing with tongue ties, it's incredibly important that we don't just go right off the bat and just start releasing tissue, because a tongue tie release, if we think about it, is really just a cosmetic procedure. So it's a procedure that is going to, yes, remove or alter the tissue, that string of fascia that is there, but it doesn't change the function inherently. So that's where a functional therapy like a myofunctional therapy comes in, wherein we're helping to really retrain all of that tongue mobility. With babies.
Before you move on, could you explain what conventional medicine does with tongue tie? Could you explain that to our audience?
Well, conventional medicine with tongue tie, essentially, I'm going to say that for the most part, they're only going to acknowledge tongue ties if it is really at the tip of the tongue. It has to be classified medically as true ankylosing. So true ankylosing is the tongue tip. However, if that frenum is short or restrictive and it's not attached to the tongue tip, more often than not, it's going to be ignored or disregarded. So it's incredibly important that we do actually acknowledge it, because the location of it is not necessarily the determining factor. Secondarily, most often than not, it's going to be just a quick snip procedure, which is not really a great way to manage a tongue tie, because you're just dealing with this external portion. We're in a true functional release, where there is a myofunctional therapist involved, or a lactation consultant, or even a manual therapist involved. You're going to get in deeper, because that fascia, we know from the tongue, connects all the way down to the toes, because that's our deep line fascia. And so if it's tight and restrictive in the outermost band that you can see in the tongue's frenum, it's going to be restrictive through the body of the tongue, and you have to release deeper in as well.
That's a really key point that you just brought up there, because you see, once again, conventional medicine is looking at isolated parts. And with you're talking right now with myofunctional therapy, I love the idea that you're saying that that tissue in the tongue, and especially that fascia, goes throughout the entire body. So we're talking about whole body benefit, right?
Absolutely, absolutely. These are things that later on you might see those strains. So that chronic neck and shoulder tension where you really just feel like you can't release through the body, where you have struggles getting a really deep breath, or if you're a toe walker or you struggle with really your posture, a lot of that is connected to that fascia, that deep line fascia throughout the
Or if
body.
you're having back pain or any pain throughout, the entire body, it seems that, this fascia, which is a covering on the muscles, can affect and cause pain throughout the entire body. So this is really fascinating. That I think our listening audience is going to get a lot of benefit to see what myofunctional therapy can do to help the whole body. I think this is really enlightening, not just for our audience, but for me as well. So thank you.
I'm happy to share.
So what would a mother do with an infant who's having problem with tongue tie?
So, a mom who is experiencing sort of latch or issues with their baby, I think their first step is to look at the function for the baby. So, they should see a feeding specialist, they should see an IBCLC and a lactation consultant, or they should see a myofunctional therapist. One of these professionals are going to be able to look at the function of what's going on with the child's tongue in order to determine whether or not functional remediation can happen just through therapeutic means before we go to something that's more invasive in nature, such as a surgical release.
Mhm. So are you able to help people remotely when they have infants who have tongue tie?
Yes, so there's a lot of guidance and structure you can provide. I think the beauty of COVID, the only beauty that we really had in COVID was that we learned how to really work better with telehealth. And so there's a lot of guidance that you can really provide to a family who is struggling, just whether it be on stretches, on holds, on how they can really manipulate the tissue and help to facilitate an optimal environment for function.
Good. Well, that's good, and I'm sure that a lot of our listening audience is being fascinated by what you're sharing here today. And so we'll give information on how they can get in touch with you later, so that if they have any questions or if they have any needs for your services, then they could use the internet and other ways that you have to educate them about this. So this is good. I know you have some courses too that I think are going to be very valuable for people as well. We'll talk about those a little bit later. But let's move into breathing, because that was one of the big areas that I really tried to get people attracted to tonight. About talking about how deep breathing, which is a significant part of myofunctional therapy, how does deep breathing affect us, and do Americans breathe properly?
Well, most Americans are mouth breathers, and that's going to be an inefficient way to breathe. You're not going to be able to really breathe deeply. We have to breathe through our nose in order to fill the lower third of our lungs. So, if you want to get the entire lung capacity, you've got to do diaphragmatic breathing. And so, that only happens through the nose, and it only happens through deep nasal breathing. And so, nasal breathing is incredibly important because that's going to be where our air is warmed, it's humidified, and that's where we're producing the nitric oxide that's going to help us with the cellular respiration that gets that oxygen and the blood throughout the body. I will say that deep breathing is something that we cannot we cannot minimize the value of, because when we're breathing from the chest, when we're not getting adequate air, that is going to impact how our cells function, how our brain functions, how we're able to sleep. It's going to really have a trickle down effect that's going to be more detrimental in the long run than it will be beneficial.
Well, here's another point I'd like to make. Again, we talk about here on the other side of medicine, we look at evidence-based therapies, and we talk about deep breathing. There's so much research on this particular area. Just for example, our breathing also affects our moods, our emotions, because the deep breathing affects the part of the brain called the amygdala, which is the emotional center of the brain, and it releases feel-good hormones. The deep breathing will release what we call endorphins and enkephalins, which are the body's feel-good hormones. I'd like to have you talk a little bit about those areas of research and things that are able to be benefited, what conditions are able to be benefited with deep breathing besides emotional problems.
Yeah, besides emotional problems, I mean, you definitely want to be able to self-regulate, and a big part of self-regulating in our autonomic nervous system and making sure we're taking care of our vagal tone and our vagal health is going to be engaging in deep breathing. We want to be able to have adequate breathing during that time, during any time when we're feeling sort of distressed. I mean, one of the first things they give you when you're having anxiety or when you have issues with anxiety or having an attack is going to be breathing exercises, right? So deep breathing, we know, can be very beneficial for regulating our autonomic nervous system and regulating our emotional, social state. Yes, go ahead.
What kind of conditions are research showing besides emotional problems that deep breathing is able to help?
Besides emotional problems, I mean, deep breathing, for what I know, is a lot of digestive and some cardiac issues. A lot of your breathing is related to that as well. When it comes to sleep and how you breathe, that's going to impact your risk for dementia and Alzheimer's. And so that's going to be higher as well if you're not getting adequate respiration when you're not conscious, as well as when you're conscious, then you're going to have higher risk for your cardiac issues. High blood pressure, very well linked to respiration and so forth.
Yeah. Could you share with us some stories, some patient testimonies that maybe you've had of benefits that they've seen that they weren't able to be helped with conventional with medicines or other therapies that conventional medicine uses, and yet when you applied and gave them training in breathing and deep breathing, that they saw dramatic changes in their health picture?
I think the emotional aspect of things is very important to keep in mind with that. When I have my cases, I am always going for whatever the goals are for that patient, and then I want to exceed them just a little bit more. I have one patient that I talk about significantly who had a very rough time. They were at a very low point in their life when I met them originally. So at that point, they had just lost their parents. They had, issues with work and were likely going to be out of work very shortly after we started working together. And they could not get any sleep. It was a very depressive, low time in their life, but they really wanted to have, it was a woman, and she really wanted to have a quality night of sleep. That's really all she wanted. She wasn't looking for any social emotional regulation. She wasn't looking for cranial nerve integration. She wasn't looking to really improve anything else. But by the time we ended working together, not only was this person who is not sleeping any more than 2 to 3 hours a night getting a full night's sleep and feeling more restored and feeling refreshed, but a lot of what they were going through and they were seeing a therapist for and were getting a lot of attention around depression and anxiety, a lot of that had alleviated just from working and getting a lot more of that awareness around the breathing and how to regulate and just bringing it consciously to the forefront. Breathing is incredibly important for just your social emotional regulation, and I can't stress that enough.
Sure. Well, I've seen with patients of mine where deep breathing has been able to help, for example, with lowering blood pressure. And I've seen it where it would lower the blood pressure on both the diastolic and the systolic. And the research actually shows that there is significant reduction in blood pressure by 10 to 15, milligrams of mercury. I mean, that's pretty significant.
That's definitely significant. I am in my practice not really taking blood pressure, if at all, ever.
Mm-hmm, mm-hmm. Yeah. Well, let's talk about some practical things that people can do. Give us some suggestions, or our listening audience can do to begin to do some deep breathing. Give us some technique that they can use to start off in that direction. I know a lot of times when I tell my patients to deep breathe, they begin to get lightheaded. They have problems because they're not breathing that way normally, and so it just changes their whole chemistry, the biochemistry of their body. So could you share some
Absolutely.
techniques to let them slowly integrate this?
Yeah, so that's the foundation of myofunctional therapy, is that we're slowly building up because you can't rush into those things. I would say the very first step is to honestly have a nasal hygiene routine. You can't deep breathe unless you're breathing through your nose. And if you're struggling to breathe through your nose, it's probably because you've ignored it for however many years you've been alive. Most of us don't get into our nose with saline or clean it or have any sort of irrigation routine for our nose to clean that area. And it's incredibly important. And so start a nasal hygiene routine, whether it's just a simple saline spray or it's something that's a bit more like a irrigation system. Most people think and associate irrigation with a neti pot. It doesn't have to look exactly like a neti pot, but it's a similar concept where you're going to be cleansing out those nasal passages. That way you can really prepare your body and optimize yourself for nasal breathing. Then you want to start off with something really slow, but that will bring you to a conscious meditative almost state. Now, a lot of people find it hard to really unwind their mind and to bring it down and to really set into true meditation. So I like to implement rhythmic breathing as a start. Rhythmic breathing is really going to have you just putting on a song somewhere between 60 to 80 beats per minute. That way you can downregulate yourself if you're a little too high in your sympathetic tone. So 60 to 80 beats per minute, this song, I want you to just pay close attention to the song and just breathe along to it. Allow your breath to kind of follow the rhythm of the song. So whether you're inhaling longer, exhaling longer, holding your breath, doing some burst breathing, however you feel, you want to consciously control your breath. But the more you get yourself aware of how you're breathing, the more you gather that awareness and control and you bring that to the conscious forefront, the better off you're going to be when you start to implement more complex breathing methods.
Mm-hmm. Oh, those are great tips right there. You know, when you mentioned that, cleaning out the sinuses with a neti pot and those other types of things you can do to irrigate the nasal passages, that's, again, from my perspective, it's treating the symptoms. And that's why earlier I talked about getting to the root cause. And that's where this delayed or hidden food allergies comes in. I've seen literally hundreds and hundreds of patients who've had repeated sinus infections, allergies that are seasonal or just, not only seasonal, but some people are very highly allergic to cats or dogs. I used to be very highly allergic to cats. I would walk into a room with cats any time of the year and I would sneeze incessantly until I identified my hidden food allergies. Prior to that, I had been going as a teenager back in the day to an allergist who was giving me allergy shots and doing various different therapies. I remember they just take these metal devices and prick my skin, and I had acne and all these problems that were cleared up after I got rid of my hidden food allergies, including my sensitivity to cats. Once I got rid of my hidden food allergies, I could walk into a room with cats and have absolutely no problem to this day. And I remember also, I used to get, if I got a bee sting, my body would swell up. If I got bit on the arm, my whole arm would swell up and it would start moving up my body. And I'd sometimes have to go rush to get to the doctor. And I remember after I got rid of my hidden food sensitivities, my food allergies, these delayed ones, I was cutting grass on a farm one day and I had cutoffs on and I had no shoes and cutoffs and no shirt. And I ran over a yellow jacket's nest. And there must have been literally 150 or 200 yellow jackets swarming over my body. I must have got bit 50, 60, 70 times before I ran out of there. And I didn't get one iota of swelling in my body. It's powerful when you get to the root cause of problems instead of just treating symptoms over and over again. And that's what we're talking about tonight. The myofunctional therapy, the delayed food sensitivities, identification of those is getting to the root causes of problems. And so, my friends, anybody listening here needs to understand you don't have to live with these problems. There is alternatives. And if you're just having your symptoms treated over and over and over again, you're having these problems are going to cause complications because you take medications and antibiotics, you're going to start really causing problems in your gut. And then you're going to have those gut issues will then develop into other problems that will go out through the entire body, and you'll be treated for symptoms for the rest of your life and develop chronic diseases. So I hope that you listen carefully to what we're talking about tonight, apply these principles that we're talking about tonight, and really get the benefits. So let's talk a little bit more about what kinds of things that you have found with myofunctional therapy that you're able to see benefits with.
I mean, myofunctional therapy is great for digestion as well, oral health. Oral health is incredibly important. When it comes to your gut health, there's that link there between the oral health and your ability to really cleanse out that mouth. So what happens is our tongue, it needs to be fully functional in range in order to adequately help us clean out the mouth. So I'm sure most people, unless you're in the dental world, you're not carrying around floss with you, you don't carry around a brush with you, and you might not be cleaning your teeth after every single meal, like right away. But what happens is your tongue actually is helping to facilitate that. But when you don't have optimal function, or you don't have really good suction, or you don't have great salivary flow, that's going to impact the oral environment, and you will have different bacteria, you'll have a different flora that will be able to live in your mouth. Now that flora combined with mouth breathing is going to really now bring down a different microbiota into your gut and introduce new bacterial strains that can really impact your digestive health and your gut health overall. And so myofunctional therapy is really, really good at helping people to achieve great oral health.
Well, that's really so enlightening what you share with us tonight. There's so much information. How do people get in touch with you, and how do they get to be able to, from long distance, get benefit from what you're able to do with myofunctional therapy?
Yeah, so just through my website, a lot of people are able to reach out to me. I'm also on social media, so everything's the Myospot, so TheMyospot. So whether that's .com, or you throw that @ sign in front of it, and that's where you could find me on TikTok, Facebook, and Instagram. You can find me there. I do free consultations. The free consultations are absolutely a wonderful way to kind of get to the root of, is myofunctional therapy the next best step for you, or is it another direction that you really need to go into? Because it's not for everyone. There's a lot of people that can benefit, but there are a select few that probably need to seek other alternative methods of healing. But the free consultations are there. My website has a lot of great information. I have wonderful courses. So there's self-study options as well, because I do believe in the value of access to care. There are so many people who might not have the resources or the means, for whatever reason, to do one-on-one therapy. There's always a course or some way, a book or a resource that's going to be able to help you to get help. And so that's available on my website as well. And through telehealth, I work with clients all over the globe, and it is something that I am just so incredibly passionate about. So no matter where you are, don't feel like, you can't reach out.
I know we were talking about deep breathing here, a significant portion of the program. You have a course on deep breathing, isn't that right?
Yeah, so I have a course on breathing, but it goes along with sleep. So it's a sleep breathing course because we're sleeping for a third of our lives. You need to get adequate respiration in order to get true restorative sleep. So it's a 5-week email course that is a wonderful process to go through with exercises and videos and a lot of great advice about things that you can do to help maintain optimal respiratory health while you are awake so that we can optimize what your breathing is when you're sleeping.
There are just literally millions of Americans who are not able to get a good night's sleep. So this course could be extremely valuable to a lot of people. So folks, make sure you write this website down and go to to Karese's website and find out about this course and all the other things that she has to offer, because education is better than medication all the time. Now, again, as I said earlier in the program, sometimes medication is necessary, but if we can prevent the use of it, well, then it's really the way to go. And I'm sure most people would agree with that. So, Karese, is there anything in parting tonight that you'd like to share with us?
Well, I always like to share that I think it's incredibly important that people continue to advocate for themselves. I think a lot of people in the traditional medical community feel that whatever is said is the absolute thing. If there is a diagnosis, a treatment plan, a concern you're having, and you're not able to really adequately have that conversation with your physician, there are people who will listen. There are people who will provide you with alternative methods. You just have to continue to advocate for yourself. Seek out second opinions, do your research, and really do continue to, seek the answers that are going to support you. So advocacy is my big thing. We need to advocate for ourselves, and that's the best way to get to health.
Yeah, now we're in the midst of an election coming up here, Karese, and I want to talk just about a minute about something I think is really significant. We have two candidates running, and last night I heard Robert F. Kennedy speak, which I really love his perspective because he really wants to go after chronic disease here in this country. And I applaud him for that. I think it's absolutely wonderful that he is so animate about getting to the root cause of chronic disease. And to me, food is the best medicine. And last night I heard Robert Kennedy's former running mate for vice president, in which they resigned from that. I guess you have a couple states that are going to actually continue on doing it, but her name is Shannon, I believe. I forget the last name, but anyways, she spoke on Chris Cuomo's podcast, and she said that Robert Kennedy, and she supports his decision to go with Trump because that Robert Kennedy has this passion to overcome this chronic disease epidemic that we have in this country. And he said that President Trump said that he is open to listening to the whole idea that we need to make radical changes. And so I'm excited that this coalition is forming. And I just wanted to see what your thoughts about that, because I'm sure that you're so aware of being in the healthcare field. The chronic disease epidemic is caused from so many variables, but food is one of the biggest ones. Would you agree with that?
Absolutely, absolutely. I think it's incredibly important that we're monitoring what we are putting into our bodies. It absolutely matters, and being as close to eating a whole food diet makes the most sense. We want to have clean diets and clean eating. Absolutely. So I'm all about the movements. I am an RFK fan, but yeah, I'm definitely a supporter of the movement.
Yeah, well, I'm excited, and this again, Shannon, the vice president running mate for Kennedy, said that there is the potential for powerful, significant change ahead if we have this coalition to end to its endpoint where they can actually get into office and have this whole milieu of things that will change, and I'm excited for that. And I'm as a healthcare practitioner, there's nothing that pleases me more to help to clean up the food supply in America, because Americans are digging their graves with their teeth, and they're being misled by advertisements, by the big government organizations that are supported by big agribusiness and pharmaceutical companies. And this whole coalition that's forming against it is going to be a powerful force to make a difference to the health of the American population. So I'm excited.
Yeah, I'm excited too. Hopefully, we'll see how it goes in November, but hopefully it goes the right way.
Absolutely. Well, listen, thank you so much. And we're going to keep in touch. And I really feel that we can work together to complement what we both do to help people to be able to achieve optimal health and live independently healthy for the rest of their lives. Karese, thank you so much, and God bless you.
Thank you.
All right, my friends, and that is the episode tonight, and we're finished with it. I just hope that you leave a comment. I hope that you like our channel and continue to follow us, because we have expert guests like Karese who bring you valuable information that will help to change your world. You don't have to live with chronic disease. There is a better way, and we can do it together. So until next week, my friends, here's to your health.